Welcome everybody to my video on how to use the new Northland District Health Board eReferrals. I'm just going to take you through the main changes to hopefully make the transition as simple as possible. The first change is that to access the eReferrals you use the H icon on the toolbar. This will take you directly to the home page where you've got both the Northland DHB referrals as well as the NPHO primary mental health referrals. So these are the referrals you use to access the subsidised counselling packages. So going through to the Northland DHB referrals, you'll see that we have a new homepage for display of our referrals. So we have added new referrals to the list. The ones we have added are district nursing services. Now this is at this point only to the whangarei service, and it's a pilot, so as long as it's successful we will add the other services down the track. We've added gastroscopy to the list. This is just the generic referral, and it's purely for patients who have upper GI symptoms that you think require a gastroscopy. If you think the patient needs a full bowel workup, these patients should be sent directly via the colorectal eReferral. We have also added a fracture clinic referral form for those patients who are being referred to fracture clinic. Obviously for these patients they need to be discussed with the service first before the referral is sent. The orthopaedic form the generic form has been replaced by a customised form, and we've also added physiotherapy services for Bay of Islands, Kaitaia and Whangarei. As of the beginning of December, we would also ask that the geriatric referral is used for all referrals for older patients who either need to be seen by their geriatrician or you're wanting to be assessed for home supports. So we have these expansion boxes here for services that have subspecialty referrals. To find them you can either expand it and click on the one you want, or you can just type in a few keywords in the search box up here and it will find that form. So let's just go through a standard referral. We'll use the audiology one, which is a generic form. We then come over here and picked a referral type. So you'll note that we've added 3 additional types. The first being additional information to an existing referral. So this is where you've already submitted a referral, but subsequent to that you need to supply some additional information such as a blood test or an X-ray result or some clinical information that you've forgotten to include in the first one. The second one is reassess assigned priority. So this is for use when a patient has had a referral triaged, but you want that reviewed, usually I assume with the request to upgrade the priority based on some change in the patient's condition or additional information you're supplying. We have an other, and when you click other you have to put the referral type. This would mainly be for things like special authority requests, anything that doesn't quite fit into here. Once you've selected the referral type you want, you then click on the next button and it will take you through to the referral form. So you'll see here that the format of these forms has changed. So the tabs that used to run down the form are now down the side of the page, so they are visible at all times. So we've maintained the fact that the summary of what is in these tabs is still there. Now this is the next change you'll notice, is that we're getting this warning sign coming up. So this patient's residential address is outside the DHB selected. Do you want to continue with this referral? This is because Mickey Mouse up here lives in Disneyland, which is clearly outside of the DHB's catchment area. So the only time you should click yes to this is if it's an acute referral, because the DHB, any DHB New Zealand will see any patient acutely irrespective of where they live. However, if this is a referral for an outpatient appointment, you probably should discontinue this referral. If the patient doesn't live within the DHB area, the referral will most likely be declined. If you feel that this patient does qualify for Northland DHB care, then you can proceed, and when you click the yes button, you will be asked to supply a reason for doing that in the administration section. So if we click yes here, and we go to the administration box, you'll see here there's the out of area referral reason. Now you just need to, if it's an acute referral, you would just type in here acute referral. If you believe this patient needs to be seen anyway, you would type in your reason. So for this instance, perhaps say this patient lives here, and that would be enough. So once you've done that, then you can go back to the clinical information. Now the other change you'll note is that there's a previously referred option here. So has this patient been previously referred for this condition? If they have, and you tick this box, we have these fields here appear. Now this one's previous consultant, previous referral date, and previous referral comments. My recommendation here is if you know the specialist, it's fine, enter it. But if you can't remember, then the service is actually completely adequate. The problem with this field here is it is actually a day, month, year field, and you have to enter it in that format. Thankfully it's not mandatory, and what I would recommend is that unless you have easy access to that specific date, I would really recommend that you come down to the previous referral comments section and just typing in the year that the patient was seen for this condition is adequate. Okay, so the next change we've introduced is to the ACC field. Now previously this didn't appear in the clinical section, which is why it was previously quite frequently forgotten. So now it's in this front page, which should help with remembering to include it when it's relevant. So the other thing that's been changed is that now if you select yes for ACC, then all of the ACC incidents that are in the patient's record will be displayed, and you just click on the one you want. Now the thing that's a little bit odd here is that you just click on the one that you want. Now I actually expected when I did this for something to happen, but actually nothing happens, and that's okay. Basically you've selected the relevant injury, and when the referral is submitted, then this injury gets populated into the form. So at this point all you need to do is move on once you've selected the appropriate accident. Down here we have some measurement details. Now these will auto-populate with measurements if you've entered them in a coded fashion, so you don't actually have to enter them here yourselves. Now we move down to the referral reason and relevant history. Now I apologise for this, it is something that we need to get fixed, but unfortunately because of a fix for an Auckland problem, we now have these boxes in yellow. Now it's not all completely disaster in that we have actually added an advanced editing function to these fields. So what I'd recommend is that if you click onto the advanced editing function, you get a white field, and what you can do here is you can type in here what the reason for referral is, and when you close this using the collapse toolbar function, then whatever you've typed in there will enter in that section. So sore is possible need for grommets, with all the spelling mistakes that we have. So that now populates into that field. I would suggest you do the same into this field here. Otherwise what you're doing is you're typing into a yellow field and red writing, which is very hard to read. So what I would recommend that you do is that you use the advanced editing function. Now the other change we've made at request is that we have this icon here, which means that if you click on this, it will insert the patient's last consultation. So if you do that, what you can do is you can then click on the editing function and it will display that consultation that you can now go in and edit, correct the spelling mistakes that you've made, and importantly I think delete anything in that consultation that's not relevant to the referral. It's a privacy issue for the patient. They don't want information that's not relevant being sent, and it also is a distraction for the specialist seeing the referral to be having to look at irrelevant information. So when you click the collapse toolbar, that information's in that section. Okay, so this is the clinical section now. Now we move on to the biggie, the attachments section. So this is where you can attach your diagnostic reports. So the big change here is twofold. One is that currently there's a 2 megabyte data cap limit on the messages you send, which is why if you try and attach a lot of photos, it can be a problem and it won't submit. So this data cap has now been increased to 5 megabytes, so there should be no problems including an appropriate number of photos. Also you'll be able to include scanned documents. So what happens here is that in a normal record it will auto-populate either the last 15 results in your inbox or results for the last 6 months. It'll auto-populate whatever's the smallest of those two. So when it auto-populates those results, you just go down like you normally do and click on the ones that you want. Now if you want to search for other documents within your inbox, then you click on the Browse Patient Document tab. So this gives you this search field. Now what it does automatically is that it'll look for records that are a year beyond the 6 months. So this date will be 18 months in the past, and it will go up to the 6-month period, because you've already got the 6-month results that come up initially. Now it's automatically going to go and find for you the last year's results. Now you can either fetch for those and find those results. The other option you do have is that you can make this a longer time frame by just changing that to say 2009, and it will search for everything in your inbox in the last 3 years. Just be warned that the longer you make that search frame, the longer it's going to take for the return to come back. Now the other thing you can do, up here it's got a name box, so you can actually search for specific results. Now I warn you that this doesn't function like a Google search, so you can't just put in liver, urine, and then expect it to return any result with those words in the result. It actually needs to have the exact label to actually find the result. Now that's a little bit of a pain, but it does have a wildcard function. Now a wildcard function is something that predates Google searches. It's an asterisk that if you enter an asterisk and then some other words and then followed by an asterisk, it will find anything in your record where there's CXR in it, irrespective of what else is written. I suppose probably a better example is asterisk X-ray asterisk, which means if you hit the search on that, it'll find any X-ray in your inbox, whether it says chest X-ray, X-ray chest, anything like that. So you can use the wildcard to find results, and when you click on the fetch, it'll return those that it's found. Oh, sorry, but this demo patient doesn't have any. And once you find those results, then you just click on the ones you want to include. If you want to attach something like a photo, you browse your local file. So that's no different than what you currently do. This will find anything that's been loaded onto your desktop. So browse local file, and if you hit the browse, it'll go into your computer and give you the options of selecting whatever you like.